Well, hello, everyone. My name is Alison Woodall, and I'm a relocation specialist. That means I get to help you with the financial, emotional, and logistical issues that make moving so stressful. And today I am talking to Garrett Montague, who is a healthcare benefits specialist based in Nashville. Welcome, Garrett.
Hey, Allison, how are you?
Well, my first question to you is, how is Nashville? Because there are so many people moving to Tennessee. Do you love it there?
Nashville's great. I grew up just north of Memphis, Tennessee, and Nashville has been a breath of fresh air. It's a thriving city. It's fun city. There's always something to do. The people are extremely friendly. We're an extremely business friendly state. No state income tax. I mean, it's great. I love Nashville. Love
Wonderful.
Nashville.
Well, I love Tennessee. I lived there closer to Knoxville for several months. It's a great state. Well, today we're going to talk about healthcare, because when people relocate from one state to another, that is a big issue, particularly if they've had the same healthcare provider for most of their life. It can be a big change. So, what's the kind of person that you can help? Who do you work with?
Sure. So I work with individuals, families, and small businesses that either are looking at an ACA marketplace plan as their primary source of coverage. We typically, I'm going to work with private market insurers that allow for people to tailor the coverage to fit their needs and aren't stuck inside of a box that in a lot of cases don't work for many people. We're allowing people to tailor that coverage to meet their individual needs. I do work with small businesses. Typically, a small business under 50 employees does not have the employee mandate through the ACA marketplace or the ACA legislation. So when we've got a small business that's under 50 employees, they're great for us. We typically save, on average, we've saved about $2,000 per employee per year for a small business employer, but also gives their employees better options to choose from.
All right, wonderful. So if someone's moving and say they qualify for Medicaid, if that's not someone you could help, what advice would you give to someone who's moving from one state to another and is covered by Medicaid?
Sure. Yeah. Someone that's on Medicaid, you're going to have a hard time finding agents that specifically have an expertise in Medicaid. The best advice I can give someone looking for Medicaid, moving from state to state, is to both contact the local Social Security office as well as the local Social Security office for where you're moving to see what is needed, what you need to do to make that happen. They're the experts when it comes to Medicaid.
And then the same for presumably for Medicare. You need to reach out to someone who's experienced in Medicare.
Correct. Yes, I focus in primarily the under 65 market. So when it comes to Medicare, it's a whole different animal. You're getting into more federal type plans. Medicare, obviously, when you turn 65, you could be disabled for 2 years and qualify for Medicare. But the specialists on that are going to be typically Medicare specific.
Perfect.
I do work with a number of different Medicare agents that are phenomenal. But definitely reach out to a Medicare expert in your area.
Okay, wonderful. Well, I feel when people move from state to state, they fall into kind of four categories. There's people who are moving and relocating with their job and their employer still is providing healthcare for them. Sure. Then there's people who are maybe moving for a new job and then they're going to have to get through an eligibility period before they qualify for healthcare coverage with their new plan. Then, of course, there's those brave people who are just moving and then they're going to find their job when they get there. And then you touched already on self-employed people, or maybe people who are moving a business who will always have to provide their own healthcare. So if we could start with people who are moving states with their job and their employer is covering them. I know you'd mentioned that the difference between an EPO and a PPO plan is very important for someone who's moving with their current company. Can you explain the difference between the two and why they're important?
Yes, absolutely. So when you are moving states, it's very important to find out, what is my health plan? Is my health plan a state-specific health plan, or is it something that is going to have nationwide network coverage? EPOs are typically that stands for Exclusive Provider Organization. They're exclusively going to offer coverage at the in-network providers in that network. So if they're state-specific EPO, that means they're only going to be accepted at in-network providers in the state of California. Well, if we've moved out of California, you could be on the hook for 100% of your medical claims if you're out of network. With a PPO, we typically find a PPO can be state specific, but a PPO is a preferred provider organization, meaning that, yes, we'll give you a better rate when you go in network. However, if you go out of network, a lot of PPOs will still offer you coverage. Now, it is still best to make sure that you either have a nationwide plan or a plan that's specific to the state that you're moving to. I do see California residents, especially with the pandemic and a lot of people working from home. Well, you can relocate and it doesn't really change anything because you're doing everything online, right? But your employer may have a plan specific to the state of California. So pay attention to that. That's something very, very important when you go to relocate.
Okay, and presumably an HR manager in a company would be able to explain what's covered and what's not covered. So then the second kind of person would be that person who is moving for a new job. There seem to be several options for that person who's either moving because they're going to find a new job when they get to their new state, or they have a job already and they're waiting for eligibility coverage. For that person, they have several options. Is it COBRA and then a short-term policy or a long-term policy? Could you kind of talk through the benefits of COBRA and first of all?
Absolutely, yeah. So a lot of people are confused when it comes to COBRA. They think COBRA is an actual health insurance plan. Really, all COBRA is just a federal law that allows you to continue on with the coverage that you had through your former employer for up to 18 months after you leave that job. So when it comes down to COBRA, and the reason people get the impression that COBRA is so expensive, what's actually happening is that you are now paying the full portion or the full price of that COBRA plan in most cases. There are some cases where COBRA, the former employer, will help a little bit, but in most cases, that huge bill you see when it comes to COBRA, that is because you are now paying the full price of that group health plan. Your employer is no longer contributing. So COBRA, it is expensive, and it is expensive for that reason.
And so if you decide not to take COBRA, then you have the choice between a long-term policy, a short-term policy, or a long-term policy.
Correct.
I know you recommend a long-term policy. Can you tell me what are obviously a short-term policy presumably would be cheaper, but what are the downsides to a short-term policy?
Sure. So when you purchase a short-term plan, you are saying that I want this coverage from this date to this date, and it's not going to go past that date. So if you needed additional coverage, you would have to reapply for a new short-term health plan. The problem therein lies that what if something happens in between the date that you pick up that short-term plan and the date that you go to get the benefits from your new employer? Well, now we're in a situation where maybe you're not able to start that job, or maybe it just wasn't a good fit and they didn't bring you on. Well, now we're losing coverage whether you like it or not. So a short-term plan does leave a lot to be desired in regards to if something does go wrong. It also typically is going to have a lifetime benefit maximum. I see them range from $250,000 to $2 million. $2 million sounds like a lot of money, but when it comes to a cancer diagnosis, you're going to run through $2 million pretty quickly. So again, I do think it's more beneficial to get a long-term plan that you can cancel at any time, so that, okay, I'm starting my employer plan today, I'm going to cancel my long-term plan today. Get a plan that's long-term that has no penalty for cancellation. It's just going to better protect you and your family.
Okay, that sounds great. I mean, I always tend to look absolute worst case scenario and plan for that. And, you know, particularly for people who are driving a long way across country, you don't know, you hope that no one will ever get in a wreck. But if something like that happens and, you know, you're on a short-term policy and then you can't start your job, or you're injured, or you have long-term, you know, injuries, then if that short-term policy ends, you presumably are considered having a pre-existing condition, which would then
Correct.
make that plan more expensive.
I mean, best case scenario is that you have a whole new deductible to satisfy if they let you get a new short-term plan. But more times than not, they're going to deem that either a pre-existing condition and not cover it, or they're just not going to offer you another health plan.
Okay, so what I'm taking from this is long-term health plan is definitely the way to go, even if you think you're only going to need it for 30 days or 60 days. And presumably you can find a long-term health plan that will fit most people's budgets.
Yes, yes. Most of the plans that I work with are going to be tailored again to that person's specific needs and or budget. When it comes down to it, there's a phrase in the insurance business that good insurance ain't cheap and cheap insurance ain't good. So when it comes down to it, you want to be careful. If it seems too good to be true, it probably is. It is very important to understand the coverage, how it works. Work with a professional. You got to realize we don't get paid by our clients. Our clients are not paying us in any way, shape, or form. So when it comes down to us finding you the best coverage, we genuinely want to help you find the best coverage.
Well, that's great to know. I know that, moving and relocating, particularly if you're relocating all the way across the states, it is so stressful. I like to have that peace of mind, even if it costs a little bit more, to know that everything is covered. I don't have to worry about it. It's just one less thing to think about. So I really appreciate you sharing all that information with us. Wherever you find this video, down in the comments is going to be a link to how you find Garrett online. You work in most states, do you?
I'm personally licensed in 35 states. I actually just helped somebody in a state that I wasn't licensed in find an agent there in that state. So it doesn't matter. Call me. I'm more than happy to help you in any way I can. If I'm licensed in that state, I can help you find a policy. If not, I can help you find an agent.
Wonderful. Well, I really appreciate you talking to me today. Thank you so much.
All right. Thank you, Allison.